Peterson. I am your room host for this Department of Health and Human Services office hours this morning. We are so excited that you have joined us today. Office hours are a new addition to the conference this year. They're meant for you to hear from different sectors impacting our housing work, hear from, in this case, Department of Health and Human Services. And we do hope you have time to ask all of your questions. A couple of quick housekeeping notes. Please do mute your lines and turn off your videos for now. Once Tracy kind of gives her initial remarks, we can get folks back on video and have a good Q&A. All sessions are being recorded. And I think other than that, Tracy, you can take it away.
Great. So I just thank every one of you for joining today. I wasn't gonna start this conversation in this way, but I think listening to Sarah Terry has empowered me a little bit to tell a story. And I work for the Department of Health and Human Services, and I came to working on this emergency rental assistance and housing stability services program in kind of a roundabout way. And I think maybe that's how all of us find our way into the work that we do. Starting in 2014, I was a project director on what is called a Money Follows the Person grant. And it was a federal grant that focused on moving individuals from institutional settings, primarily nursing homes, back out to the community. And through that work, over the course of several years, it became very apparent to me that the key to successful community placement is solid housing opportunities, so affordable, accessible housing. And I started to poke at that a little bit from a policy perspective. So reading everything I could about federal policy and what we could develop in a Medicaid framework. So I kind of became a little bit isolated in looking at housing as a social determinant of health and how Medicaid funding could assist with payment for housing navigators who help people figure out how to get to the community and all those things that you have to do, right? Like your moving costs or household setup or first month's rent and deposit, and just all of those barriers that might come with getting into a home in the community. And this was way before COVID hit, right? And so fast forward to now, starting probably with another project a couple years ago, and then most recently our partnership with the Emergency Rental Assistance Program, which is housed in the Department of Commerce, and it's funded with U.S. Treasury funds. And I'm going to pull my slides up now because this will be where I lose your faces in order to go through these slides. But this is a partnership between the Department of Commerce that has the emergency rental assistance to provide to those who are behind in their rent and utilities and are affected by COVID, and the DPHHS Housing Stability Services Program, which I've been working in partnership with many others to help create. And so I want to talk a little bit about the newly developed Housing Stability Services Program, just to get information out to folks about that. And just in a nutshell, the Montanans who are eligible to receive housing stability services are those who would also be eligible to receive emergency rental assistance. And that means those Montanans whose household incomes don't exceed 80% of their area median income for the county that they live in. And they have to have experienced financial hardship either directly or indirectly to COVID. And they've got to demonstrate a risk of experiencing homelessness or housing instability. And that can include a past due rent notice or eviction notice, a past due utility or utility shutoff, or an indicator of some sort for unsafe or unhealthy living conditions. And that can include overcrowding. And so, as I mentioned, that emergency rental assistance program is administered by the Department of Commerce, and that funding came down through a couple of different federal pathways. Right now, we're working under the funding that we're calling ERA1, and it was granted to the state through the Consolidated Appropriations Act. There's a Treasury guidance link on these slides that you can go read your heart out on all of the federal policy and guidance that got us to where we are. The key objectives of this emergency rental assistance funding is to support those urgent COVID response efforts to, prevent the spread of the virus and to keep the pandemic under control, and to assist renters most in need to avoid those evictions and secure housing. It's also to alleviate the financial distress of landlords who rely on rental income to support their well-being. So it's multifaceted. Now, in general, federal program guidance allows for rental assistance. That can be up to 15 months of rental assistance. It may cover back rent or prospective rent. It can cover utilities and home energy costs, your electricity, gas, water, sewer, trash removal, and it can cover other expenses such as your internet expenses. The best way to apply for emergency rental assistance is to visit the Department of Commerce's website, and you'll see this kind of brown bar across the top. You can't miss it. It says emergency rental assistance. You can click there to apply if you personally or you know anyone or are working with someone who could benefit from emergency rental assistance. So that's just there's a lot to the application process, but this will get you to the starting point, and there's lots of good guidance from Commerce about that. Now, the program that we just launched through DPHHS this spring, the Housing Stability Services program, is for those people who qualify for emergency rental assistance, but they might want some additional help one-on-one, kind of navigating the whole housing landscape that's happening right now. And so the Housing Stability Services will help align an individual with a housing navigator, and they are available through a statewide network at our local human resource and development councils. And they can offer some very specific services, and I'll break those down a little bit. There's tenancy consultation services and tenancy support services that a housing navigator can assist an individual with, and in turn, what this program does is open up a funding mechanism for those agencies who are providing housing navigation services, because we know the landscape of finding and keeping housing is getting more and more complicated in Montana. So this is a way to start addressing that. So our tenancy consultation services begin when a person works with a housing navigator. That housing navigator is going to do a screening to make sure that a person is eligible for the housing stability services. They're going to do a comprehensive assessment for housing needs, maybe what the barriers are and what the preferences of that person is. They're also going to do a social determinants of health assessment that helps identify some other areas a person might need assistance with, because we know there are a lot of factors that make a person successful in finding and keeping housing, and it can be linkages to food needs or to utility assistance or to employment. So that social determinants of health screening is going to help identify where some other connective referrals might need to happen to other services in the local community. That housing navigator is also going to work with an individual to develop an individualized plan to find and keep housing, in a nutshell. So the agency that provides housing navigation can also bill for the time spent doing these services. So either tenancy consultation or tenancy support services. And these services take up really 2 slides. I'm not going to read them in depth unless you have got additional questions, but there's a whole all kinds of activities a housing navigator might help a person with to get to a successful housing placement. And that can be things like identifying resources to cover housing expenses, assisting with the housing search and completing those applications, or applying for housing vouchers that can make a unit more affordable. A person might need help collecting their required documents. There might need to be some good advocacy around landlord and tenant relations. We talked a little bit about referring to other agencies and provider resources. Just a quick snapshot here: providing fair housing counseling, educating about reasonable accommodations and modifications, ensuring successful move-in, I mean, how do you be a responsible tenant, and that relationship building that needs to happen. So just in a quick and dirty nutshell, for you folks that are on the line, if you know someone that you're working with who, is behind in the rent or struggling to keep up, you can make referrals to the Emergency Rental Assistance Program on the Department of Commerce website. And then in turn, if you know someone would need some additional help with a housing navigator to work with them, those referrals go to your local Human Resource Development Council. And we are working with 9 of the 10 HRDCs across the state who have housing navigators on staff who can assist. So just tell them you're interested in the Housing Stability Services Program. And then I put state contacts. We're running this program with 2 others. I'm Tracy Clark. Jackie Hoover is my staff. We also work with Sarah Lowen, who's in the Human and Community Services Division. So those are the points of contacts for us. And I really want this to be interactive. So I've given my spiel, and I want folks to be able to Q&A.
Great, thanks, Tracy. Does anyone have questions for Tracy about what she shared or any other programs you're working on? Feel free to turn videos on, come off mute, or you can use the chat function, and I'm happy to help moderate that. Andrew, did you have a question?
Yes. Would that cover like building a handicap ramp into a tenant's house or their, I believe they own their home.
So the specific Housing Stability Services Program is going to be geared toward renters. So this is applicable to tenants. So in your particular situation, a homeowner would not be eligible for any coverage for a ramp under this program. However, a reach out to your local HRDC or perhaps your area agency on aging could reveal some coverage for a ramp. And I've noticed some other partners that are attending this call who might have some resources that I don't even know about, because coverage for ramps and home modifications like that, I've encountered a whole lot of different pockets of funding for that. So if anybody else on this call has an answer for Andrew, I know there's some great resources on this call.
Thanks, Tracy.
Mm-hmm.
Andrew, where are you located?
Up in Great Falls.
Okay. I don't know if anyone is on from Great Falls who could speak to any local resources. I know in Missoula, there's some support through Summit Independent Living, and the Human Resource Council locally has provided some support for ramps in the past. So maybe similar organizations in your area.
And if the person happens to be on a home and community-based services waiver, sometimes those have coverage for modifications and ramps. So, and I don't know if you know whether that person's aligned with a waiver program.
I just got a note from my boss about it, and all I got was, where could I go to help an elderly disabled man get funding to fix his wheelchair ramp? That's the note that I got that I'm working from.
Okay. Well, I know what you're going to be doing for the rest of the day. Feel free to reach out. Just you can find me, on the state website too, if you want to shoot me an email, and maybe we can make some connections.
All right. Thank you.
Mm-hmm.
Do folks have other questions for Tracy or Sarah, other folks on her team? Tracy, I have a question just going back to your opening comments about Medicaid waivers. Where are you at on that kind of conversation? What are you seeing? What's your interest there?
Oh, I'm glad you asked. I don't know how many on the call are familiar with the governor's HEART initiative, and don't ask me to define HEART right now. I just don't have the focus to tell you what that acronym stands for. But through that, I am part of a work group developing tenancy support services under the HART waiver. And so those are going to be targeted specifically to the population with a serious mental illness and substance use disorder. And so the tenancy supports really align with what I presented as our housing stability services. So that will be forthcoming in the next 12 months or so, that service could be up and running. So it's in the works. It won't serve folks as broadly as what we're able to do under the emergency rental assistance funding, because that's really open to anyone who qualifies for emergency rental assistance under the Commerce program. But it's a step in the right direction in my mind.
That's great. Thanks for sharing that.
Mm-hmm.
Michelle, you came off mute. Do you have a question? No? Okay.
Michelle, do you want to make a plug for Money Follows the Person and some of the, you also provide services to a really targeted and specific population, but do you want to talk about that?
So it looks like her microphone isn't working.
Okay.
But Michelle, if there's anything you want to post in the chat and share with the group, we'll see it there.
So while, unfortunately, Michelle's, as you said, her microphone isn't working, but I may take a moment and ask Juliana Campbell, who also works within our Intergovernmental Human Services Bureau and manages 2 other housing programs that we are able to provide assistance with. I can answer Michelle's question here. She's wondering if Tracy can share which HRDCs are working with the program. So all of the HRDCs, all but one of the HRDCs are working with the program, but we do have coverage across the whole state. The specific area with the HRDC that's not currently involved in the program is being covered by one of the others. And if you are interested, we have a referral sheet that we can share with you as well. So I'd like to take a minute and ask Juliana to speak a little bit about our Emergency Solutions Grant.
Hi, good morning, everyone. Can you hear me? I've been having some microphone issues too. Great.
Yeah. Sound great. Thanks.
Great. So I'm going to talk a little bit about 2 of our housing assistance programs. One is the Emergency Solutions Grant, and the other is HOPWA, Housing Opportunities for People with HIV and AIDS. The Emergency Solutions Grant program really aims to assist individuals and families with little to no income who are either experiencing homelessness or who are at risk of homelessness to regain stability through the services provided with the program. We work with 9 of the HRDCs across the state to cover the entire area of Montana. We can provide a list of contacts for you as well if you would like those. But they really have control over their programs in their local communities. The Emergency Solutions Grant can pay for street outreach activities, shelter activities, rapid rehousing, and homeless prevention activities. In a typical year with regular ESG funding, it's pretty low for our state. So the focus has predominantly been rapid rehousing and homeless prevention assistance. But with the Emergency Solutions Grant program through the CARES Act, they've really been able to open up the venues through which they provide assistance and have funded street outreach activities and shelters too across the state. Specifically with rapid rehousing and homeless prevention assistance, there is really an array of the specific assistance that each of the HRDCs can provide. They can provide rental assistance, up to 24 months of rental assistance. Typically, just based on funding, they do restrict it to 3 to 6 months of assistance. They can help with past due rent. It's a one-time payment for up to 6 months of rent arrears. They can help with rental application fees, security deposits, moving costs, housing search and placement, housing stability case management, and really trying to secure the stability for those people who are moving into housing. Applicants for rapid rehousing assistance must be literally homeless by definition, category 1 of HUD, or fleeing and attempting to flee domestic violence. Those who are literally homeless do not have to meet an income determination requirement, which is a big benefit because there is no burden of having to prove that verification of income. With homeless prevention assistance, however, applicants must be at risk of homelessness. So they have to be served an eviction, they have to meet other requirements. For example, they're living in a hotel or motel that they're paying for, they're exiting an institution or system of care, such as a mental health facility, correctional institution, foster care, etc. Maybe they've moved 2 or more times in the last 60 days because of economic reasons, or they're living in someone else's home because of economic hardship and they can't stay there anymore. These would all be defined under homeless prevention. And they do have to meet an income threshold. They must be at or below 30% of the area median income. With ESG Cares funding, that has been increased to 50%. So there's a little bit more flexibility there. With HOPWA, Housing Opportunities for People Living with HIV or AIDS, we actually partner with 4 agencies across 3 states to implement that program. We partner with Open Aid Alliance in Missoula and the HRDC in Billings to cover the state of Montana. And we partner with Community Action Partnership in Fargo, North Dakota to cover North Dakota. And we also partner with the Sioux Falls Housing Council in order to cover the South Dakota region. And for HOPWA assistance, the agencies really focus on tenant-based rental assistance for eligible applicants. An eligible applicant must be someone who has a positive HIV diagnosis and is at or below 80% the area median income. There are also opportunities through the HOPWA program for short-term emergency assistance. Short-term emergency assistance is usually a one-time assistance for up to 21 weeks to help an individual or family who has a crisis. And that can help with either rent or mortgage assistance. And there's also supportive services through that grant as well. And supportive services includes case management. There could be a stipend for food or nutrition, transportation services, some limited health assistance as well. And I'm open to answer any questions that you might have.
Thanks for that great overview, Juliana. Does anyone have questions? We have just a few more minutes. Tracy, is there anything else you would like to share with the group today?
Just that I think a huge thank you needs to go out to everyone who joined this office hours and who are attending this conference. It demonstrates to me how many people this is important to and how many are doing this work across the state, and just a huge thank you to everyone who's helping folks on the ground.
Thank you, Tracy. And I would echo that back to you and Sarah. It's been really hard navigating COVID with everyone, but I think also really powerful to build stronger connections across state government agencies and with all of these wonderful nonprofit and local partners. And I'm looking forward to those partnerships continuing. It actually looks like Andrew does have his hand raised. Go ahead, Andrew, you have a question?
This is available on recording also in case we missed some of the information, right?
That's right. All of the recordings will be available on the conference website for 6 months following the conference. So you should be able to find all of this there. Yeah. And hopefully presenters will also post their slide decks, or Tracy, if you're willing to share the slide deck, we can get it posted for you as well.
Who do I get that to?
You can send it to me and I'll make sure we get it posted.
Great.
Okay. Well, wonderful. Thank you so much, Tracy, Sarah, Juliana. And just a reminder that conference website is a rich platform. There's a lot of opportunity to continue conversations there, post questions, share resources. So we really encourage everyone to take full advantage of that conference site. We have a quick 15-minute break now until 11:30, and then we'll have our table talk sessions at 11:30. So we hope to see you there. Thanks again, Tracy.
Thank you.